All right, party people, we are back at it with another one. Let's get it. All right, so we've got a 6-day-old neonate born at 38 weeks. Mom is Rh negative. She is G1P1. The baby's had jaundice for about 12 hours, and the mom reports difficulty with breastfeeding and attachment. Now, as far as the labs, total bilirubin is 11, direct bilirubin is 0.9. So before we go any further, let's run through what it is that we're evaluating here. So we're trying to differentiate physiologic jaundice from pathologic jaundice. Now, you have to know the 5 criteria for pathologic jaundice. The licensing exams love this. You're going to have to be able to differentiate through these. So let's run through the 5 criteria so that this becomes easy. So first, jaundice within the first 24 hours of life. It doesn't matter the cause. If it shows up day 1, that's pathologic. Next up, persistence of jaundice after 1 week in a term baby or after 2 weeks in a preterm baby. All right, now, as far as total bilirubin, if it's above 12 to 15, now different textbooks will give you different cutoffs, but for the USMLE, they'll make it obvious. They'll give you something like 18 or 20, not 13. So it's not going to be a close call. You'll be able to recognize it just because it's so far away from the average. Now, as far as direct, aka conjugated bilirubin, will be above 10% of total, even if the total is under 12 to 15. The fifth point is the rate of the rise being above 0.5 milligrams per deciliter per hour. All right, not 5.0, 0.5. And yes, they love to give you tables with 2 time points, such as 12 versus 24 or 36 hours, and you have to be able to calculate this. So you have to memorize these 5 points, and if none of them are met, it's physiologic jaundice. Now, in our case, none of the 5 criteria are met, therefore, this is physiologic jaundice. Now, notice how they try to mislead you with the difficulty breastfeeding. Just based off that, a lot of students will jump to breastfeeding jaundice, but that's incorrect. This is physiologic jaundice. Do not overthink this. Now we have to differentiate breastfeeding from breast milk jaundice. As far as breastfeeding jaundice, this occurs in the first week of life. It's due to the inadequate intake. If you have less milk, you're going to have less bilirubin excreted in the stool. This decrease leads to an increased amount of enterohepatic circulation. Now, the treatment is to educate the mom on how to feed correctly. So this is going to include feeding technique and supplementing with formula if necessary. As far as breast milk jaundice, this is benign despite being pathologic. Now, it starts on days 3 through 5 and peaks around 2 weeks. This is caused by beta-glucuronidase in breast milk, which deconjugates bilirubin. This increases the amount of bilirubin in the enterohepatic circulation. And the treatment is just to continue breastfeeding. The key takeaway here is even if the story feels like breastfeeding or breast milk jaundice, if the 5 pathologic criteria aren't met, you will choose physiologic jaundice. All right, for bonus points, let's go over hemolytic disease of the newborn. For Rh incompatibility, you have to know this. This happens in the second pregnancy or later, never in the first. You're going to have a Rh negative mom with a Rh positive fetus. The mom will develop IgG antibodies after the first pregnancy. These will cross-react with the placenta in later pregnancies, and in turn attack fetal RBCs. This can be prevented with ROGAM. As far as ABO incompatibility, this is more common on your licensing exams. The vignette will give you an O positive mom with an A or B positive fetus. Now normally, anti-A or anti-B antibodies are normally IgM, the pentamer, which is too large to cross the placenta. However, the type O mom can form IgG. These can cross the placenta. The IgG antibodies can cause hemolysis, and it can happen in the first pregnancy. You have to know this. All right, let's spin the block and go over the 5 criteria for the pathologic jaundice. Jaundice within the first 24 hours. Jaundice after 1 week in term, or after 2 weeks in preterm. The total bilirubin needs to be above 12 to 15. Direct bilirubin has to be above 10% of the total. And the rate of the rise has to be above 0.5 milligrams per deciliter per hour. If none of these are met, you're dealing with physiologic jaundice. Now, this is a classic question for your licensing exams. It's straightforward once you memorize the criteria. All right, that's going to be it for this one. If you like the video, like the video. If you have requests for other questions or topics you'd like me to cover, leave it in the comments. And check out my Substack, where I also post walkthroughs on how to answer these types of questions. Link will be in the description box below. All right, go crush it.